Hi, I'm Beverly, and my section has to do with major or mild neurocognitive disorder due to Alzheimer's. Before I start, I'll let you know there's some words that I'm not going to say correctly, so please bear with me. Alzheimer's disease, also commonly referred to as Alzheimer's dementia, is a DSM-5 diagnosis assigned to individuals who are experiencing cognitive deficits directly related to the onset and progression of Alzheimer's dementia. Alzheimer's disease or Alzheimer's dementia is a neurological disorder in which an individual experiences progressive cognitive dysfunction due to the incursion of beta amyloid plaques and neurofibrillary tangles in cholinergic neurons. Acetylcholine production of the affected neurons decreases, which is clinically manifested as progressive memory loss and associated behavioral symptoms. The symptoms of Alzheimer's disease. DSM-5 criteria for Alzheimer's disease is as follows. A, the diagnosis criteria for major or minor neurocognitive disorder is fulfilled. B, insidious onset of gradual decline of cognitive function in one or more areas for mild neurocognitive disorder, or two or more areas for major neurocognitive disorder. And the third one is the diagnosis criteria for either possible or probable Alzheimer's is fulfilled. Now, for major neurocognitive disorder, for probable Alzheimer's disease, for the diagnosis of probable Alzheimer's disease, there has to be evidence of a causative Alzheimer's disease, that is genetic mutation from family history or genetic testing. There also has to be clear evidence of decline in memory and learning at least one or another cognitive domain based on the history or neuropsychological testing. There also have to be steady, progressive, gradual decline in cognition without extended plateaus. The third one is there should be no evidence of mixed etiology, which means absence of other neurodegenerative or cerebrovascular disease or systemic disease or condition contributing to cognitive decline. If these elements are not present, then a diagnosis of possible Alzheimer's disease should be diagnosed. Risk factors for Alzheimer's disease. We have several risk factors. So here are three. We have environmental, genetic and physiological, culture-related diagnostic issues. So with environmental, we have traumatic brain injury that increased the risk factor for major or mild NCD due to Alzheimer's. We have genetic, which is age is considered the strongest risk factor for Alzheimer's disease. When it comes to cultural-related diagnosis issues, detection may be more difficult in cultural and socioeconomic settings where memory is considered normal in old age, and also where older adults face fewer cognitive demands in everyday life, or where very low educational levels pose greater challenges to objective cognitive assessments. Development and course of this disease. The onset of symptoms is usually in the 8th and 9th decades. Early onset forms seen in the 5th and 6th decades are often related to known causative mutation. Symptoms and pathology do not differ at different onset ages. Younger individuals are more likely to survive the full course of this disease. Older individuals are more likely to have numerous medical comorbidities that affect the course and the management of the illness. And diagnostic complexities is higher in older adults because of the increased likelihood of comorbid medical illness and mixed pathology. Comorbidity. Most individuals with Alzheimer's disease are elderly and have multiple medical conditions that can complicate diagnosis and influence the clinical course. Major or mild NCD due to Alzheimer's disease commonly co-occurs with cerebrovascular disease, which contributes to the clinical picture. When a comorbid condition contributes to NCD in an individual with Alzheimer's disease, then NCD due to multiple etiologies should be diagnosed. I have included a link to a video on living with Alzheimer's. Hope you enjoy it. And thank you for listening.